I've done that in our group. Not with our group, but in that seeds class that I went to. Oh, one of them, they were
How many people need more time in your discussions? Does any group need a little more time? Okay, great. That, by the way, is a strategy to use with kids who have anxiety disorders, because frequently what we do is we expect transition really fast, and we don't predict it, and we don't honor timelines of our students. And I say that as somebody who taught for many years, guilty as charged many times. So I'm just coaching now that oftentimes, I'm standing up here and I'm saying, okay, I'm getting a little tired of standing here, so I'm going to call people back. But instead what I want to do is check your process. Are you done talking? Have you said everything you want to say? And in order to prevent oh no, that group's going, I bet. I bet. And there are groups like that, right? So the way as a group leader that you deal with that is, okay, I see a group needs a little more time. Let's wrap up in about a minute. We'll give you another minute. And then everybody else in the room knows that there is an end to this and that we're not going to be sitting and waiting for the processors, to be talking another 15 minutes or so. It's just processing, absolutely. So that's just a strategy, something that I'd give you as a tip. And same with your kids at home, giving them some prediction about when things are going to happen. In about 10 minutes, we're going to start getting ready. I'm going to give you a little sign when it's time to get your coat, that kind of thing. But making sure that people are prepped for transitions. Transitions can be very scary because oftentimes kids don't know what's coming next, and if they don't know, they fear. So thank you for that. Maybe we could offer, too, a couple ideas about what you thought would be important. First of all, why teachers and parents need to know about this stuff, and then what you hope to gain from the training tonight. Any comments about that? Either something you said or something brilliant you heard one of your teammates say.
Well, I think one of the questions we have, some questions that we were kind of...
A two-pronged question, yep. And then the first part is about prevalence, and are these kinds of disorders becoming more prevalent, or are we better at diagnosing? And that is really the age-old question. And there are a couple schools of thought, as there are, on most topics. I think that what we're seeing is the impact of having an advanced society where things are so fast-paced and where life is moving so quickly. We don't have as much natural reflection time. So I do think we are seeing more anxiety in children. However, we are also much better at diagnosing it. So it's really hard sometimes to ferret out exactly what's happening. But certainly we're seeing a lot of it in our schools. And then the second part of your question was the impact of technology and how that might affect, I am assuming, anxiety and some other mental health kinds of issues with kids. The interesting thing about technology is that there's good and bad. It's just kind of like everything. And so there's a lot of evidence that, for instance, surgeons who use robotic surgery have improved hand-eye coordination as a result of practicing, using the technology that's available to us now. There's also, just like any other addiction, an addiction to technology that some kids have where it impacts them with frequency, intensity, and duration. They lose friendships, have consequences, impairs relationships with parents, may cause them to not learn other things that would make them a more well-rounded person. So I guess I would recommend watching the kids who are using it for good and to develop some skills, and it doesn't seem to be harming some of those major life functioning areas, and then intervening when it does. And there are therapists out there who specialize in video game addiction and that kind of phenomenon that we're seeing with kids now. But thank you for that question. Yes?
Well, we're kind of so that we get as much help.
So this group, no wonder you had so much to talk about in your group. Yeah, so this group, This group was processing, sharing information related to childhood trauma with people who may be able to do something about it in another environment, and wondering about sharing all that information. I think it's wonderful to alert people to trauma experiences. How many of you have heard of the ACE study, the Adverse Childhood Experiences Study? Okay, we have a person in the back. It's the biggest study nobody's ever heard of. The Adverse Childhood Experiences Study, and it's out of Kaiser Permanente. And if you Google Adverse Childhood Experiences or ACE, you'll find it. It'll just pop up on your screen, and there's some wonderful presentations and information about it. Basically, the study was with 17,000 patients at Kaiser Permanente who were asked about their childhood experiences, and the experiences were clustered into what would commonly be perceived to be negative experiences. Things like having been physically abused, things like living with a parent who's chemically dependent, things like feeling like nobody loves you in the home, having somebody who's incarcerated, etc. So there were 10 factors that they pulled out that they called adverse childhood experiences. And the results were to track sort of, how did those experiences relate to, originally their interest was to some health factors later on in life. And they were astounded when they found out the results, because most people do have adverse childhood experiences. Most people have, at least one. But some people who have 5, 6, 7 are known to have a shortened lifespan of up to 20 years on the average. Up to 20 years. And you can think about it and kind of guess what the outcomes might be. Alcoholism.
Mental illness.
Mental illness.
Like drives it.
Yes. Heart disease. Diabetes. So all of those kinds of diseases, and they are all diseases, were much more prevalent and much more life truncating than any other kinds of experiences. So that study, every single person, I believe, who has any interest in anything should learn about the ACE study. There's a local person, Mark Sander, who trains about the ACE study, and I train with him, actually. I'm becoming an ACE trainer myself. But it's fascinating material. If you ever get a chance to go to an ACE training, please do so. There's also on the web an ACE calculator, and the ACE calculator allows you to get your own ACE score, to actually take the screening and find out how many ACEs you have in your life. And the good news is that when we know that something predicts something, we can intervene. We know then that we have to intervene. So it's great to know about the adverse childhood experiences of grandchildren, your children, yourself, and it's not rare. Believe me, it's not rare. So I digressed a little bit there, but that's so important because trauma is a big contributor to stress and anxiety. So these are the things that we want to consider in school settings. All educators should think about these things: having a positive behavioral climate in the school, having tiered interventions, things that are positive for everybody, things that are targeted for a few, and things that are very specialized for children who have very significant needs. That's okay. Equal isn't necessarily fair. It's unfair in many ways when kids have much more intense needs than other kids. We have to make accommodations. In some cases, we have to make modifications for students. Simple classroom and environmental modifications, and it's so simple to do things like call children by their names and smile when they come to class in the morning. To tell them that you're happy that they're there. How great to see you today. So glad you came.
I saw this thing on Facebook. It was this teacher that would I don't know if anyone saw it, that his students would come in the door and he would give them a compliment every day. Have you seen it?
I have seen that. It's a teacher who gives, I'm just repeating your statement, a teacher who gives compliments to all of his students every day.
And then they do it to each other. And then how the whole climate changed through the years with these kids and how they treat each other. It was a complete change.
Thank you.
They did the same thing as he did to them.
Yes, so the comment, the kids then started to pick up this particular complimenting behavior, and it's really amazing. I wish I knew what it was called. It was a YouTube something or other on Facebook. It was circulating, yeah, and I don't know what the name of it was, but it's a kind teacher giving compliments to a student. So you probably could do a Google search, and it seems to me they were special education students, if I remember right. So it's well worth watching. And that's starting the day with positive energy. And I've sometimes demonstrated to people that if you came into class and you were an anxious child, and the teacher started the class by saying, okay, today's D-Day, we're having a test, only 70% of you are going to pass it. Good luck to the rest of you. Or, today's a day when we're going to see what we've learned. We're going to see if we can share some of the things we've learned the past 2 weeks. The difference, in framing something that way is huge when a child has an anxiety disorder. So we just have to remember to watch our language. Competition is not our friend with kids who have anxiety. Mild stress is okay. And mild stress might be we have team 1 and we have team 2. We have some handouts at the front of the room. I hope I made enough. One of the teams might not get one. And then get that interest and that energy going and have the kids come up and pick up the handouts. That's mild stress, just mild. Am I going to get one? Am I not going to get one? But things like, 30% of you will fail by the time this semester is over is not a good trajectory, especially for kids with anxiety disorders. And then the importance of parent-school partnerships, the importance of what you folks are doing with the grandparent group, that's huge. Making sure that there's communication and partnership between schools and parents, and to share what works with your child. So oftentimes, teachers mean well. We all went into this field, those of us who are educators, because we generally wanted to work with kids and do good things. And so our missteps are really just that, just missteps. And we really need to learn better ways and more positive ways of interacting with our students. And it can be done. Even old dogs can learn new tricks. And then appropriate mental health services. A big move in Minnesota now is school-based mental health services. Millions of dollars have been appropriated for that. So many of our schools have mental health clinics right on site. There was a time I remember 25 years ago where we were talking about this stuff and people were really concerned about the stigma. And, somebody will see a child walking into a therapist's office and they will be stigmatized. Well, what we found out is that in schools, it's just Miss Carson down the hall or another person. It's another staff person in the school because everything becomes so seamless and there's communication, regular communication between teachers and therapists. And it's largely a good thing. Every once in a while there's a bad partnership, but for the most part it works out pretty well. I want to talk about the causes of childhood mental health disorders. First and foremost, genetics. We're all born with a template or a blue plate special, a blueprint for what's going to manifest itself in terms of our mental health functioning. So just think of yourself as having this template, and it gets launched in some people, and the way it gets launched is through stress oftentimes. So think of even identical twins who are born with relatively similar, the same DNA, and they are, one of them goes off and has a path of behavioral problems and another one doesn't, and people sometimes wonder why that is. Even identical twins have different environmental experiences. They have a different relationship with their parents. They may have different teachers. One may have suffered trauma, the other one not. There are all kinds of different ways that twins are compare and contrast themselves. And just try sometime, if you're an identical twin. Do we have any identical twins in here? Nope. So what's interesting to me, and it works every single time, is you say if twins are sitting next to each other, which one of you was born first? The hand goes up right away of the firstborn, because already they start to differentiate. Who's the older, who was born first, who weighed the most, who had a dimple on the right cheek and the other one didn't, or more likely a mole, something like that. So they start to differentiate themselves right away. So environment is very, very important. It's about 1/3 genetics and 2/3 environment in terms of what happens to us.
So you mean we got a chance?
We have a chance, yes. That was the comment. You mean we have a chance? Yes, we do. And our kids have a chance. And what I like about that environmental genetics message is that it gives us hope. It's not just a done deal. We can't just say it's hopeless. That kid can't improve. That kid can't get better. I have seen kids who have significant autism, ADHD, anxiety, learn wonderful calming strategies and being able to do it themselves and say, it's time for my breathing now. It's time for me to take some deep breaths. I need to go for a walk right now. I need to talk with my study buddy. You know, they have their whole list of interventions and they pull from them and choose them when they need them. They can be taught to do that. Brain physiology is another cause of mental health disorders, just how brain development occurred in utero. Disruption in neurochemical transmission, and that's that whole serotonin, dopamine, norepinephrine phenomenon. These are all of the environmental stressors, and there are many more, I'm sure, that can impact whether stress and anxiety manifest themselves. Family stress. It's very stressful for a child to live in a home where there's a lot of discord, where there's a lot of arguing and fighting, where there's abuse. Not good at all. It's one of the ACE factors for children. Deprivation of basic needs. So kids who aren't fed will read horror stories sometimes about kids who've been locked in closets and deprived of physical contact and friendship. And stressful life events, losing a parent, especially at certain critical ages. It's difficult to lose a parent. That's also an ACE factor, losing a parent in childhood. Individual personality traits, just things like some people have a sense of humor and they're more magnets for other people. Other people have easygoing personalities. Other people suck the energy out of a room when they walk in, So it's just, you're all over the place with those kinds of friends, right? And some people pull you and others you feel a push away. So that personality piece can be really important. That's why it's important to work with children, too, about things like, Jan will attest to this, birthday party last night. Thank you for the nice present. I really like it. So those kinds of skills, and just really working with kids and reminding them that that's what wins friends and influences people. And it doesn't mean you're phony. It means you're gracious. And it's important to learn those skills. And then cultural norms in communities. It's really stressful to be a cultural other in a community. It's like you have to learn to be bilingual, bicultural, bifunctional, because you're in two different worlds. I live in Northeast Minneapolis, and I live right across the Broadway Bridge from North Minneapolis, and I was walking across the bridge, and I was watching a young man walk, and he happened to be African American, and he had pants, drooping way down, and he was kind of walking with a swagger, and he had a baseball cap turned backwards, and had headphones on, and was kind of dancing as he was walking across the street. And we got to the stoplight in Northeast Minneapolis, and I watched him code switch right before my eyes. Pants pulled up, baseball cap turned around, earphones down around his neck, started walking down the street in Northeast Minneapolis. And I thought, he has learned how to function in a couple different worlds. And he just demonstrated for me switching up when he needed to. That's what people who live in a community where cultural norms are different from their own families, own communities, have to function. And that's stressful. That's why I mentioned it in the context of mental health. That's stressful. Another stressor that folks who don't have to do that haven't experienced. So this is the reticular activating system. Just think of it as a sieve. It's a reverse sieve, and all of that input that's coming in gets filtered, and some of it gets up to the brain and some doesn't. So the reticular activating system in people who have anxiety disorders takes in almost everything that could be stressful. And so some people will just say, whatever, let it ride, let it roll off your back. But people who have anxiety, it gets in anyway. And so it's really recognizing, first of all, there I am being anxious again, or there I am feeling sensitive again. There I am thinking automatic negative thoughts. So it's teaching kids some self-awareness, and that we all need to know what we're doing, what our brains are doing, and have a name for it. It helps us to calm down if we can name it. Oh, that's happening to me again. I'm feeling worried. automatic negative thinking. And with real little kids, you can have them make even little ants and write their negative thoughts on them and then put them on the ground and they stomp out their ants, physically stomp them out to get rid of automatic negative thoughts. So when we're in a non-stressed state, our amygdala is like a filter and it allows our thoughts to freely flow to the prefrontal cortex. So it allows our thoughts to just go here and we can process them and think about them. But once our stress load becomes constant and huge, it's referred to as allostatic load, and it means we just carry it around to the point where we do it so long it becomes the new normal. And allostatic stress is very real and it's life-shortening. So we have to make sure that we recognize it. One way to recognize it, and I'd encourage all the adults in the room to do this, and you can do it with young people too, is when are you in your happy place? Think about the times when you are really, really calm. It might be getting a stone massage. It might be running. It might be being with friends and talking, processing. You know, it might be doing something like going golfing with a buddy or reading a book, thank you. Yes, reading a book, being in a hammock, doing yoga. You know, any of those kinds of things are very relaxing. You do yoga, don't you? And so all those kinds of things are helpful to us. That's what the absence of stress feels like. So on a daily basis, you have to ask yourself, am I in that green place, that green stress place right now, where it's like I'm having a stone massage, a hot stone massage, or it's like I'm practicing yoga? Most of us would answer no at any given time during the day because we start with that little stress in the morning and it starts to build, and if we don't discharge it, it becomes part of our allostatic load and it's just this baggage that we carry around all the time. So we have to do something to discharge that, preferably on a regular basis. So it might be deep breathing 3 times a day. It might be doing some guided imagery, you know, thinking about a beautiful place you've been and just going there in your head. It might be talking with a friend and getting some social and emotional support if you need it, going for a walk, going on a canoe ride, whatever it might be. But to make sure that you go to your green zone at least once a day. And that's a big switch up for most of us. Most of us don't go there very often. So when we're in a stress situation, what happens to this colander is it's got too much fruit in it and it's too big, and so it clogs the ability to send those messages to the frontal lobe, and it's like a gate that closes. So there we can see a depiction of, this is the feeling system, that amygdala, that worry spot, that worry and novelty place, that closes access to the prefrontal cortex, and then all we do is react. I was heating up a latte, I think it was this last weekend, and my daughter was with me, and I meant to press 2 minutes, and I must have pressed 20, and she went, "Mom, your coffee's exploding all over the place." So I ran to the microwave, and there was coffee everywhere. So, but instead of just waiting for things to cool down and to take some time to think, I took a bunch of paper towels and I just threw it in there and I spilled the whole rest of the coffee all over the inside, all over me, all over the floor. And so that was just reacting. I wasn't thinking. I was just reacting.
Excuse me.
Mm-hmm.
This is another prevention.
So the comment is that a child, I presume, a young person, is not thinking when he's stressed and is just kind of reacting and not thinking things through, I guess, or not processing. So what to do in those situations is, again, back up and teach specific strategies for him to use. And I would even do it from this book, 10 Mindful Minutes, that Goldie Hawn wrote, because it's 10 little minutes every day to practice a new strategy. And it's just a great book. It's wonderful for parents, grandparents to use. And we've used some of those strategies, my granddaughter and I, just in terms of taking some deep breaths and learning to calm and doing a yoga pose, that kind of thing, because it really can be helpful. So he's lacking the strategies, and even if he has a list posted on his wall, or he wears, some of the kids wear a little card that has different strategies on that they can just pull, or there are apps on the iPhone that they can access that give them strategies to use when they're feeling stressed. What he mostly needs is movement, relaxation, and to be taught some self-awareness about strategies that he can pull from when he's feeling really anxious. And check out the Mind Up curriculum too, because the reason I was an author of the Mind Up curriculum, and I get no residuals from it. It all goes to the Goldie Foundation. But that is a great curriculum because it costs less than $20 on Amazon for certain grade levels, and there are tons of strategies and activities that are mindful based in there. One of them is perspective taking. How to help a child teach that just because you're thinking something doesn't mean that it's important to other people or that they're thinking the same thing. Really important skill for people to have. Or just because you're thinking that you're the most awful person in the world doesn't mean that other people think that about you at all. Teach them to check it out.
Do you think this ages and stages learn from them? I don't know.
Yeah, so the comment is, isn't some of this just like normal teenage stuff, and you can tell kids are not going to do drugs and they're going to do them. And that's absolutely true. Yeah, they're teenagers, and you can almost predict even when kids go into chemical dependency treatment when they're teenagers, you can predict relapse. They're going to relapse for the most part. Very few kids go into treatment and it's all better or in recovery for the rest of their lives. So it's really important to know. So the key points about anxiety is it impacts classroom and everyday function in many ways. Anxiety disorders in children are brain-based, so we have to always remember it's in the brain. It's not their imagination. We used to tell kids, oh, it's all in your head. Well, we were right, but that's not how we meant it. It is in our head. It's our brains. There are many effective interventions that can be used at home and in the classroom, and I would refer you to the MACMA handout. I use the handouts from MACMA all the time. How many of you are familiar with MACMA? Heard of MACMA before? Okay, we have a few people. So the Minnesota Association for Children's Mental Health is one of the biggest child advocacy organizations in the field of mental health. Also, the National Alliance for the Mentally Ill is very much getting into children's causes. But MACMA was kind of the grandfather of this kind of support system for parents and for young people. And their fact sheets are just nice synopses of every mental health disorder. Then they offer tips for intervention. They offer resources for parents. They have and others, and teachers and mental health professionals, and they have a conference every year. Their conference is coming up actually next week. They have a conference in Duluth every year, and it's the largest children's mental health conference in the nation. So if any of you ever get a chance to go to a MACMA conference, they're outstanding. They have speakers from all over the place. This year, one of their keynotes is a friend of mine, Dr. Henry Emmons, and Dr. Emmons writes a lot about the neuroscience of joy, the chemistry of calm, those kinds of topics. And he's a holistic psychiatrist, so he gives all kinds of tips about intervening from a holistic perspective, even though he's been trained as a medical professional. He also uses psychotropic medication when he has to, but he's very much a holistic thinker and a wonderful man. We know that there are many effective interventions, I mentioned that, and that children do not recognize their own anxiety. So children will often complain of stomach aches, or they'll say something like, so-and-so doesn't like me and they're mean, so I'm not going to do that. So they'll use other reasons, but they will rarely say, I'm feeling rather anxious today. We don't hear children say that. So here's the center of anxiety in the brain. It's a structure called the basal ganglia, and it's the worry center of the brain. When people have an anxiety disorder, that basal ganglia is overactive. It's worrying and hyper-focusing. Think of a person who holds grudges, can't let go, can't move on. It's that same kind of phenomenon, stays stuck in that worry mode. So it's basically hyperarousal of the central nervous system. And think about the kids who have been traumatized especially, which of course is not the case with all children or even most children who have anxiety disorders. But when we talk about kids having experienced trauma, their resting pulse rate is very rapid. And so then we know that they are hyper aroused and are ready to kind of fly at any moment. Sometimes children's anxiety is very general, other times it's very specific. So now what I'd like us to do is if you would take your anxiety disorders handout, and if you'd stand up in your row, but stand up in a little group, and there are 1, 2, 3, 4, 5, 6 types of anxiety disorders that are identified in the MACMA tip sheet. So in the 6 groups, talk about that disorder and what that might be like for a young person who has that disorder. Thank you, everybody, by the way. We just are not going to have time to process for the large group, but I hope in your small group it gave you some insight about one of the anxiety disorders. So this is an important visual because it illustrates the full effect of anxiety. So it impacts our mood, our cognition, and our physical changes that occur that result in behavior changes. So almost every aspect of our being is impacted by anxiety. And these are some of the moods and symptoms that will be seen in anxiety disorders. Most important, we look at the fight or flight or freeze or shut down responses, very typical with anxiety. Quick to anger. In children, it might look a lot like irritability, just as depression sometimes looks like irritability in children. So if you see a child who looks like they're really irritated, and maybe you can gauge that by whether you're feeling irritated by their behavior, think anxiety. And certainly the hypersensitivity, feelings easily hurt, being sad all the time. And then sluggish thinking, slow to participate, memory difficulty, difficulty concentrating, things like automatic negative thoughts, which we talked about earlier, and excessive worry about things like homeworks and grades and assignments and tests. And then physical changes can be things like chest pain, shortness of breath, things like abdominal distress, flat affect, crying frequently, hypersensitivity to the environment, frequent absences, very common. In fact, a Brown University study showed that most of the children who were truant due to anxiety were staying home with an anxious parent. And we see that oftentimes in schools. Yeah, they keep each other company. And we talked about the neurochemicals before. A really important neurochemical in anxiety is cortisol. It's a stress hormone, and it impedes flow of the good neurochemicals. So when people are feeling anxious and stressed, there's a lot of cortisol in the brain. Mind Up, the program Mind Up that I mentioned before in my shameless commercial for that curriculum, actually one of the results was reduced cortisol levels in children. And they knew that because the children who participated in the curriculum did spit tests. They sent them off to Germany, analyzed them, and compared to the control group, the kids in the Mind Up program had much lower stress levels. So it's really a successful program, very outcome-driven, very evidence-based. So this is an illustration of a child who might have an anxiety disorder. This was a student I worked with in 287, saw his whole family murdered, hid under the desk when the bell rang. We took care of that by disabling the bells in the school. We found out we really didn't need them anyway. The kids could learn to tell time and could announce when it was time to leave class. He thought a classmate was stalking him, very easily startled. That's one way it might manifest itself. Many other ways, kids who are afraid to take tests, who are absent when tests are given, who have meltdowns when there's going to be anything that calls for a performance in front of the class. So again, anything that you can read about, learn about mindfulness, about calming, about strategies like guided imagery, yoga, those are all successful interventions. The key is relationship, nurturing a positive relationship with a child, whether you're a parent or an adult. It's the single biggest predictor of good outcomes with kids is that they can identify one adult in their lives who was constant, there for them, who they felt had their back, even if they had others who couldn't show up for them. So with that, I'm going to end there, and if you'd like to stick around and have questions or anything, I'll stay for till 8:30. Thank you.